What are you looking at? It is an ECG tracing, but do you know what is it in reality? In reality, when you are looking at an ECG tracing, you are looking at a human heart from different angles and sides. You would be wondering how. If you really want to understand that, please watch this video till the end. But before that, please subscribe the channel and hit the bell icon. Thank you. Today we are going to discuss the different leads in the 12-lead ECG tracing and the views of the heart that they provide to us. Whenever we attach an ECG to a patient, we are actually looking at the patient's heart from different views. So we attach the precordial leads, we attach the limb leads to the patient, and as a result of that, we get 12 different views of the heart on the ECG tracing. So we get an AVR on the ECG tracing. The AVR lead looks at the heart from its base. So the AVR basically looks into the atria of the heart or the base of the heart. Any changes in the right atria or at the base of the heart would be depicted in this lead. Then we have the AVL, we have the L1. Then when we attach the precordial leads, we towards the left lateral side we attach V6, then V5. These four leads together gives us a lateral view of the heart. These leads are also called lateral leads, and they provides a lateral view of the heart as they look at the lateral wall of the. Any changes in these leads mean that there is a problem with the left lateral wall of the heart. Then we have V4 and V3 in the chest leads. These two leads together are called anterior leads, and they provide an anterior view of the heart. So any problem with the anterior wall of the heart will be shown in these two leads. Then in the precordial leads, we attach V2 and V1 to get a V1 and V2 view, or V1 or V2 lead. This V1 and V2 lead provide a septal view of the heart. They are called the septal leads, and any changes in the septum of the heart will be depicted in these two leads. Then we have lead 2, AVF, and lead 3. These three leads together are called inferior leads, and they provide an inferior view of the heart. Basically, they look at the inferior wall of the heart. Any changes in the inferior wall of the heart will be shown in these three leads. For instance, if there is an MI of the inferior wall, there would be ST elevation in lead 2, lead 3, and AVF. Now let's look at atrial depolarization as to what happens when the sinoatrial node fires. When this sinoatrial node generates impulse, this impulse travels all over the atria, and the atria undergoes depolarization, and due to its electrical depolarization, it contracts and the blood is pushed into the ventricle. Now, as a result of atrial depolarization, we get a P wave in the ECG trace. Now, when we look at the ECG, you may find a positive P wave in certain leads, and in maybe in one or two leads you may find a negative P wave. Normally, why does that happen? That happens because the principle is if the electric potential or current is moving towards a lead, it will have a positive wave. And on the other hand, if the electric current is moving away from a lead, it will have a negative wave. Since P is a wave, and in the atria, the electric potential is moving away from AVR, what happens is we get a negative P wave in the AVR. And since the electric potential or electric current is moving downwards and leftwards, it is moving towards all other leads. That's why we get positive P waves in all the other leads of the ECG trace. Thank you very much. For more videos, please like and subscribe the channel and hit the bell icon.